The coronavirus pandemic has forced a number of countries to introduce travel bans restrictions, ranging from quarantine measures, border closures, flight suspensions, and health screenings. By this morning, the Africa Center for Disease Control and Prevention reported that 48 of Africa's 54 countries had in place some form of restriction. 24 of those countries exercising a full border closure. Some of the countries like Uganda still allow cargo, freight and emergency transport in and out of their borders. 10 countries, including Uganda's western neighbor Kenya, have imposed international air traffic closures. Elsewhere, 7 countries such as eastern neighbor Democratic Republic of Congo have set up travel restrictions to and from specific countries. A further 7 have entry restrictions for travelers from specific countries. Such restrictions include either banning entry or suspending visa issuance. The other countries on the continent have simply imposed mandatory quarantine for all travelers arriving from high-risk areas. Tanzania is one such country, and its president, John Pombe Magufuli, has been criticized for not acting quickly. New data from the Imperial College in London indicates that millions of lives will be saved if countries act quickly. This study looked at the health impact of the pandemic in 202 countries using a number of different scenarios and based its estimates on data from China and high-income countries. The study concludes that doing nothing to combat COVID-19 will leave the world facing around 40 million deaths this year. Public health measures could reduce that number to 9.3 million. The number further shrinks to 1.3 million if the measures are rapidly adopted.